Alrighty. Hi, everybody. My name is Crystal McIntosh. I am a third year medical student at Drexel. Thank you guys for showing up and taking the time to come to this panel. Today we have our Sowing Seeds panel is going to be being a minority female in medicine. And I just want to start off by saying thank you to our speakers for being here and just taking this time out from their schedule. I want to start off by just introducing everybody and then we can get started. So today we have Dr. Oyetewa Asempa, and she is an assistant professor of dermatology at Baylor College of Medicine and the director of the Skin of Color Clinic for Baylor's Department of Dermatology. She was born and raised in Atlanta, Georgia, and then went on to graduate summa cum laude from Howard University in Washington, D.C. She completed her medical training at the University of Illinois at Chicago College of Medicine, during which time she was able to complete a year of research at the NIH. She completed her internship at George Washington University and then her residency training at the Harvard Dermatology Program, where she served as chief resident in her final year. She specializes in hair loss and scalp disorders. Outside of medicine, she enjoys writing short stories as well as writing and performing spoken word poetry. So welcome. All right. And next we have Dr. Ade Osunubi, which she is a documentary filmmaker, freelance journalist, and an EM resident physician at the University of Pennsylvania. Her work focuses on sharing the stories of minority populations that often go untold. While in medical school, she independently produced Black Motherhood Through the Lens, an award-winning documentary about 4 Black women's experiences in navigating the reproductive healthcare system. Her work on the film was also recognized in Forbes and PBS, amongst other places. Asanubi has published articles in ABC News, Washington Post, HuffPost, Essence, Teen Vogue, and Glamour magazine on topics related to health equity. She is the founder of the Creatives for Social Change in Medicine initiative that has educated over 50 students and healthcare professionals on how to engender creative solutions for equity issues in the healthcare field through media and storytelling. Due to her efforts, she was the recipient of the 2025 Rock Health Top 50 in Digital Health, 2024 Boston Celtics Heroes Among Us Award, the 2022 National Minority Quality Forum 40 Under 40 Leader in Health Award, and among others. So welcome. Okay, and last we have Dr. Chidima Achulanu. She is the current chair and trustee for the postgraduate section of the NMA, which supports residents, fellows, and early career physician members. She is a pediatric emergency medicine fellow at Children's National Hospital in Washington, D.C. She completed her pediatric residency at University of Chicago, where she also served as chief resident before transitioning to fellowship. She earned her medical degree from Morehouse School of Medicine, where she was actively involved in the Student National Medical Association, SNMA, and continues to work closely with medical students through SNMA. Beyond her clinical fellowship, Dr. Achalanu also serves as the communication chair for the section on minority health, equity, and inclusion for the American Academy of Pediatrics, and is a current scholar for the Emergency Medical Service for Children's program, where she is working to optimize best practices for utilizing security and law enforcement in emergency department spaces through a trauma-informed lens. Prior to matriculating to medical school, Dr. Achulanu earned her Master of Public Health degree from George Washington University with a concentration in community-oriented primary care, and afterwards continued to work in the school health sector through health education, health promotion, and capacity building with Chicago, Washington, D.C., Baltimore, and Alexandria public schools. She earned her bachelor's degree in biology and psychology at Rutgers University in New Brunswick, where she served as a resident assistant, president of the NAACP, helped to recharter the MAPS charter on campus, and was initiated into the I'm gonna butcher this, Chi Nu chapter of Delta Sigma Theta Sorority Incorporated. Dr. Achalanu is most passionate about building communities, reinforcing a diverse physician pipeline, and promoting best practices for the care of children, especially those from the most vulnerable and marginalized populations. So welcome. Okay. So does everyone just want to give me a thumbs up that we're ready to start questions? Great. Okay. So the first question that I wanted to ask kind of relates to your personal journey into medicine and how your identity kind of was associated with it. So what originally inspired you to pursue a career in medicine? And did you have any female role models in training that influenced your career path?
I can start first. What first inspired me to be medicine? I always jokingly say I don't know if like my Nigerian parents were just whispering "be a doctor" in my room at very early age, but I have truly and genuinely wanted to be a doctor since I was 5, and knew I wanted to do pediatrics relatively early as well, and have been pretty unwavering in that. I think that to get to this point, there have been women both who are actually clinicians and then those who are outside of medicine who have really helped to shape where I've gone in medicine, and frankly could not have gotten to this point if there weren't women pouring into you. I think, we'll get into this conversation more, no doubt, but particularly in medicine, that is holistically a male dominated field, but even in pediatrics that is relatively female dominated, it's integral, frankly, to have women, particularly who look like you, who understand your experiences, because navigating this space can be demoralizing if you don't have good sounding boards to guide you along the way.
Yeah, I was gonna say, can you guys hear me?
Yep.
Okay. Yeah. So I also wanted to be a doctor since I was like, I don't know, born. So same thing. I see that we're all Nigerians on this panel somehow. So there's something in the water that they carried over, for sure, on the plane. So I also wanted to be a doctor since I was a kid. I did have some people that really I was inspired by their stories. Ben Carson was one, notwithstanding the way his career went. But he was a huge inspiration to me as a kid, reading his books and just the story of his mom and how she pushed him. And so I wanted to be a pediatric neurosurgeon, since I was a kid because of him. And over time, when I understood what that meant, I started dropping off things, first neurosurgery, and then, in medical school, came in wanting to do peds and ended up switching to ortho. Did dimensions for ortho. Okay. Switched to OB-GYN. Then third year, did OB-GYN, hated it, and got pretty depressed in med school, took a year off. And it was during my year off that I decided to do derm. And so when I think about the people in my life that helped me to get to where I am today, it was women up and down, that helped me. I think about obviously my mom in terms of the inspiration that she was, the go-getter that she was my entire life. But then within medicine, I think about so many people, Crystal Agu, Dr. Okoye, she's at Howard now. Crystal is at Hopkins. And these were people that when I had first started thinking about dermatology, which again was very late in the game, I had been hardcore ortho, hardcore OB, right? I'm hardcore for whatever it is I think I'm doing at the time. So I didn't have anything for dermatology by the time I had decided I was starting to be interested in it. And I remember I cold messaged both of them on Instagram. No, what am I talking about? On Facebook, because there used to be YBAD, this group of, is this YBAD still exist, this Facebook group? Oh, okay. It's still, people still in there? Anyway, at the time it was real poppin', and they had published a textbook called The Fundamentals of Ethnic Skin together. And I saw that, and I'm a little measly little medical student, but I was like, wow, a textbook on ethnic skin. Let me reach out to them. I cold messaged them on Facebook, and I'll never forget that Dr. Okoye messaged me back within 11 minutes and was like, if you can get up to Hopkins right now, I'll give you the game. And I was like, bet, right? Get in my car, drive up to Hopkins, because at the time she was at Hopkins. And, in 45 minutes in her office, she told me everything I needed to do. She told me where I was deficient. She told me what I needed to hustle on. She told me, if I see you again and my advice has not been followed, I'm gonna know what it is, right? And I really appreciated the tough love that she gave me and just really leading the way for me. So I could not have made it without, those are my two biggest mentors. But then there's been so many women after that, women that look like me and women that don't look like me, in my residency program at the Harvard program, my program director, little Asian woman, phenomenal mentor. Put me on in so many ways. And so I definitely echo everything that's been said already about the importance of navigating this space, with the help of all kinds of mentors, but especially the women who are going to be looking out for you. I think of it as mentorship is one thing, advising is a lower tier, but then sponsorship is something different. When people are like, I am going to put you on, I'm going to put you in a position, I see something in you, it's up to, I'm going to make it on, put it on my own head, as Nigerians would say, to get you into this space. And that was what I was fortunate enough to be able to build. So I'm happy to talk about some of the methods to build those kinds of relationships.
Can you guys hear me? Okay, cool. So like the other two phenomenal women, I too wanted to be a physician at the age of 5. My mom's a doctor, so she was board certified in anesthesia and then switched to occupational and environmental health. So I wanted to be like my mom growing up, so that also meant becoming a doctor. She very much did not force me to become a doctor. She very much was like, very much think about it. She didn't discourage me, but she kept it real with me. And so what I really appreciated about her was that she really put me on very early. She made sure that I made my CV at the age of 13 or so, just updating things. She connected me with colleagues. So I actually would go with her to this conference called the Association of Nigerian Physicians in the Americas, or ANPA. I'm sure that rings a bell for a few people who are listening. But basically, I remember that conference because there was a particular session on postpartum hemorrhage. And then there was also another section on obstetric fistula. And so both of those really got me interested in women's health. Before I just knew, okay, I want to be a doctor, didn't know exactly what specialty, but then it was in my teens and I was like, okay, women's health definitely sounds like something I'm interested in. And so my mom really advocated for me. She connected me with one of her colleagues. One of my first mentors was Dr. Gbenga Ogadegbe at NYU. I had the opportunity to get an NIH diversity grant, which I don't think exists anymore, but hopefully will come back with a new administration. So I had the opportunity to do research at NYU all 4 summers of high school. And so that was a really great experience. And then my god sister, well, I call her my cousin, but she's my god sister technically, Dr. Tosino Dunsi. She is an OBGYN, and she has been a really phenomenal mentor. And her father, who's also an OBGYN, really counseled my parents and were like, if she knows she wants to be a doctor, she should consider BSMD or BAMD programs, which was not something I was familiar with. And so when I was applying to college, I applied for Brown's 8-year program in liberal medical education, or the PLEME program. And I went to a boarding school in Massachusetts, very much like New England, very white, elite vibes. And it was very much focused on the humanities. I was studying Latin, I was studying Spanish. Not that many people went into medicine from my school. So my parents really encouraged me to apply to the program. I didn't think I was going to get in. I was actually going to switch my early decision application to another school because there was a boy there that I was interested in. Anyway, we digress. My parents were very much like, you should apply to the PLEME program, early decision. So I applied, and by God's grace, I got in. And so that was a really great opportunity because I didn't have to take the MCAT. I did have to take some pre-med courses, but I didn't necessarily have to, get A's on all of them. And through that experience at Brown, I was able to focus on some of my other interests, which is basically the point of the program. And so I was really focusing on photography. And then when I got into medical school, that's where I started doing more documentary film work. And that's how I created my documentary, Black Motherhood Through the Lens. And in medical school, I also had a number of mentors. As I mentioned before, I was very much interested in women's health. And so automatically I thought OBGYN, nothing else. So I came in, going to do OBGYN, I had a lot of mentors, Dr. Lene Brayboy, Dr. Amaka. They're wonderful Black women OBGYNs, and they just allowed me to shadow them. But then it came time for fourth year. I did my OB rotation like towards the end of my third year. I just couldn't really see myself living that lifestyle. And so I switched to emergency medicine. We can talk about that a little bit later. Still afforded me the opportunity to work with women identifying individuals, but to also give me the opportunity and flexibility to pursue some of my other interests as well. And as Dr. Asampa said, you know, some of my mentors have looked like me, some of my mentors have not. Dr. Teresa Schrader, Dr. Lisa Schwartz, those are two wonderful white women who have been really important mentors in my life. Dr. Schrader really helped me with creating my documentary. Dr. Schwartz-Toper really helped me with some puberty work that I've been doing. So that's kind of been my journey so far, a little bit non-traditional, but super grateful for all the people who have supported me along the way.
Okay, thank you guys for sharing that. You know, it's great to just hear that you guys have had so many positive role models in your lives so far, and them all being female is also amazing. And I think seeing more women, whether it's women of color or those who aren't women of color, in the position of medicine is really inspiring, and it kind of makes you feel like this is going to be great. I can do this. So I'm just wondering, you've seen women who are there, but was there a pivotal moment when you realized in medicine, like, this is my passion and it's great and I'm going to be a woman in medicine, but also it's going to be challenging to be female and in medicine? And maybe you can even talk a little bit more about your specialty specifically, or specialties you decided not to go with.
Well, I mean, I can speak about a little bit of that, particularly when you mentioned speaking about specialties you decided not to go with. So, you know, I mentioned that I switched my mind a bunch in medical school, but you know, I was definitely hardcore OB-GYN for a portion of that during my third year. And I remember, you know, being on my OB-GYN rotation, and the way that my rotation worked out, I had a resident that was, all of us kind of were assigned to a resident, and the resident that worked with me immediately just decided that she hated me from looking at me. I don't know what it was. I walked in immediately. Fire. Okay. So that entire 3-month rotation, I was under just, I mean, when I say I became depressed as a third year, it was that rotation, because obviously I'm the kind of person who, I honored every single rotation in medical school except for OB-GYN, and that's what I really wanted to do. So, you know, I was killing myself to honor this rotation. And now it's funny because looking back as an attending, I understand some of the things that sometimes when students are very overeager, there are some things that we do that actually definitely are not ideal, okay, especially in a surgical space. So I was very overeager, but I mean, I was on my stuff, but this person really hated me. And I felt like, you know, with women, we have two different modes that we can be in when we're in mass, okay? And in this rotation, it was all women. There were no men faculty, no men residents. There were some men medical students, okay, and they definitely got treated differently than I did on the rotation. They got treated very well on the rotation, okay, but the medical students that were women were treated extremely poorly. So, like, women, when we get together, we can support each other, we can love each other, we can uplift each other, or we can decide to get together and hate each other, tear each other down, treat each other poorly. Unfortunately, that was the environment in which I was on this rotation, where the women were very catty towards each other, catty towards the women medical students. And it was a really poor environment for me. And so I think it's kind of funny, because you would think that if I had been on a very male dominated rotation like orthopedics or something, that's where I would have had that experience where as a woman I felt uncomfortable, but this was in a very women dominated field. So I think it taught me, first of all, the importance of knowing your own worth and knowing who you are, because sometimes when you come into a situation in which people are hostile, you immediately think there's something you did wrong, but there are some situations in which there's nothing you can do to please that person. Now, again, like I said, I've looked back and I've understood some of the things that could be perceived as annoying, right? Like, I'm doing a surgery, sis, back up. You know what I mean? Give me a little bit of space. You're in my space. However, I think the way I try to operate as an attending now is when I see a medical student that's a little overeager, I try to help guide them by explaining to them, like, I love your enthusiasm. Give me about 2 feet and then, hold up this thing right here, help me in this way, whatever, right? There are ways to do it without crushing someone's spirit. So number one is, if someone is crushing your spirit, don't automatically assume it's because you're trash or you suck or whatever. There are things that are going on with other people, with faculty, with residents that have nothing to do with you. And then number two, don't assume that every woman in a space is there to help you or to hold you up. Unfortunately, that would be ideal. But definitely there are some people who will decide that they're jealous of you for no reason, who will decide that you don't deserve to be in a space. Okay, I've had other women in medicine tell me, on my surgery rotation, I got a negative grade on my professionalism. It got fixed, trust. Okay, like I said, I honored. But when I saw my grade, I said, let me go see what's up, And of course, this faculty, a woman faculty, told me it was my hair. Okay, and I wore my hair natural all through medical school in a wash and go. Okay, so it was out, it was free, but it was professional in my opinion. That's how my hair grows. It was well kept, it was clean. Okay, washed weekly. All right. But she told me that my hair was unprofessional and maybe I should wash it more. Why did I spend so much time to make it curly like that? I'm like, this is how it grows. And so little things like that were the ways in which I felt like if I had been a male, those were not things that I might have dealt with, at least not in the way that it was dealt with. And again, standing up for myself, identifying people who did support me, knowing how to speak up for myself is why I was able to make it through those things. If I had just accepted my negative grade when I saw it, I would have not got that expunged, right? When I went to ask her what the problem was and she told me what it was, I said, okay, bet. I went to Office of Student Affairs, okay, and that got removed from my record. And a bad professionalism grade is really hard to get off of your record, right? So anyway, I'll stop talking, but those are some of the things that made me realize, even though I'm happy to be here, there are challenges about being a woman in this space. And there are women that will support me, but there are also women that will try to tear me down.
Wow, thank you. I don't know if there's anyone else who wants to answer this question. I want to also give space for that as well.
Yeah, I can go. Thank you so much for sharing that. I will say, I kind of have had just the experience of being the only Black woman in a space since I was a child. My parents were very much like wanting me to be in private school, which I'm very grateful for, but that happened to just be in a lot of white spaces. So I grew up in Central Jersey. That's a lot more diverse than where I went to boarding school. So when I went to boarding school in the middle of nowhere, Massachusetts, that was definitely a huge culture shock for me. And it was really hard to be a Black woman in that space. When it comes to desirability politics, all of that, it was really tough. So I already kind of had that experience just being a Black woman, people just viewing you as like ugly or just undesirable, and just not worthy of being there. So that took a lot of work and therapy to work through, but I already kind of had that experience just being a Black woman, those challenges, etc. When I went to undergrad, things were pretty smooth sailing. There was a lot more Black people. Brown is very much like a liberal space, so it was better vibes for the next 4 years. But then when I got to medical school, that was also another shock to the system because medical school tends to be a lot more conservative than undergraduate spaces. So when it came to social activism, those types of things, I wasn't prepared for getting backlash for some of the things that I was involved in. So like my first year, I just won't even go into too many details. There was a pretty big incident my first year, which unfortunately led to a woman of color faculty member being fired. And then later on that year, I had spoken up about, unfortunately, a Black maternal death that had occurred at my hospital, which was public knowledge, and had been talked about in various forums. And so for our SNMA chapter, we had these health topics of the month. And so that health topic of the month was Believe Black Women. So I had a line in there about the Black maternal death that had occurred. And then unfortunately, I was told that I broke HIPAA, the hospital tried to come after me, etc., even though I did nothing wrong, even though this was publicly available information and had been talked about in various forums in the medical school. So that was a really challenging situation to go through. Luckily, like I had my mom there who she does medical legal work. So, you know, it was like, you absolutely did not break HIPAA. Like, this is just the name of the game. And I was able to, you know, not kind of walk away unscathed, but it did cause a lot of anxiety. I remember losing a lot of weight, having stomach issues that I didn't know was attributed to anxiety. So that was pretty stressful. And then later on, like even when I was creating my documentary, I did receive a lot of support, but I was pretty nervous about publicly releasing it during medical school because I had received some advice that, you know, if I released this during medical school, that could negatively impact my match because it's talking about racial topics, etc. I wound up releasing it during medical school, doing screenings, etc. But those are just some of the scenarios that I encountered while in medical school. And then I remember during my third year, there was my family medicine rotation. I thought things were okay, right? Like I didn't think they were great, but I thought they were fine. I had 3 white women that I was working with. And to my surprise, I was told at the end that I had to remediate the rotation because I lacked lifelong learning. You know how they always have these little things, right? And, you know, at no point during the rotation, I was told that I wasn't meeting expectations. And that was actually the highest shelf I had throughout the year. So then I had to go through a appeal process, and this was my last rotation of medical school of third year. So you know how the devil likes to be creative. So that was the last rotation I had before fourth year. And then during my vacation week in summer, I had to go back to another family medicine site to finish up. Luckily, I was able to get whatever negative comments removed, so it wouldn't be on my MSPE, which is the stuff that gets sent to residency. But again, another stressful situation, another situation where I just felt like I was blindsided. No one communicated with me. So those are just some of the mishaps I had in medical school. However, I am grateful for them because there are people who are also experiencing these types of things in clerkships. This is it's not uncommon for Black students to receive poor evaluations on clerkships. It's been studied, right? So when students are having those experiences, like I can walk them through, hey, this is how I appealed this. This is exactly how I wrote this appeal. It was like a 10, 11-page appeal. And, you know, it's very important to get written feedback and keeping receipts of that, because in any instance when they're like, oh, this student do X, Y, Z, you have the written feedback, and that's kind of what helped me. So going through that experience definitely helped me help other individuals in the future. And I will say, as an emergency medicine resident, I do feel very supported by my program. There's 4 other Black women in my program, so we have a very diverse class. But I will say sometimes it is tough, especially working with, you know, some nursing staff, some other members of staff, even some patients. You know, even yesterday I walked in the room, you know, I had my doctor tag. A patient was like, hey, sister. I was like, look, I had to hold up the tag like, that's not my name. You know what I mean? So just like different things like that can be challenging when you're leading a code or leading a resuscitation. So just, you know, trying to command the room, but also not trying to come off as, you know, too demanding. You know, there's that balance that, you know, other people of other identities don't necessarily have to deal with. But unfortunately, these things are not uncommon, and I'm definitely a resource to talk through, you know, those types of situations.
I agree 100% with what both of my colleagues have said. And I think that, so Dr. Asampa made such a great point that I really want to bring it back up, that the thing that you learn pretty early in medicine is that there are 2 types of women in this space. There are the women who create community, who are looking out for you, who understand that we don't have to function with a scarcity mindset, and there actually is enough for us all to be at the table and for us all to succeed. And then there are others, for various reasons, who are just not about that. I think sometimes you expect that because we've all already navigated this world as Black women, and so we know that that's going to just be the way sometimes we enter a room. I think it's hardest when that's sometimes actually even coming from people who look just like you, where they may have been socialized or had experiences where they are actually so accustomed to being the token Black person or the likable Black person that they've never had a space where 2 could exist and don't even know how to do that. And so I've definitely had those experiences, which can be really hard because it almost is like a betrayal when you enter a space and you're like, oh, great, there's more than one of us, but that's actually the person who is creating the most unsafe, like psychologically unsafe space for you, which is horrific. And then Dr. Osanubo, she talked about desirability politics, and I, doing pediatrics, like also need to talk about the likability politics because pediatrics is like a very woman dominated field. But I am a 6 foot tall Black woman who started residency older. So I was older than, if not as old as some of the attendings, certainly some of the fellows. And even in fellowship, actually, quite often in fellowship, I find myself in these spaces where I'm getting evals that say that I'm rude or condescending, I'm too dominant, like all of these buzzwords that really are trying to allude to the fact that I'm like an angry Black woman, when really I'm just confident about the spaces I occupy. I'm sure about myself, about who I am, and about how I carry myself, what I know and what I don't know. And there are some individuals who really will expect you to small yourself and make yourself like fit into this tiny space. And again, I'm a 6 foot tall Black woman with a very big personality. So that just, I can't do it. That's something that can be hard to navigate. I'm certainly happy to talk about that more, but really being able to recognize, like to a certain point in residency, I actually literally just stopped reading my evals because people will put things in your eval that they would never have the balls to say to you to your face. And if they can't actually bring it up to you and talk to you about it in a constructive way, it really is meant to just be like, like to break you down, cut you down. So I think that like in those two ways, it can be really challenging. And then the other piece, again, I think not unique to pediatrics, but probably seen a lot more, is there's like pure woman on woman crime that happens, particularly with nurses and women physicians, because, and I see my colleagues like also, try to hold back because now, particularly if it's a non-woman of color who's a nurse, and then you as a woman of color, there's multiple things happening. There's sort of a gender war, as if there can't be multiple of us in that space. But then there's also this idea that like, oh, you're Black and a woman, like, and I'm supposed to answer to you. Like, what do you know? Why am I answering to you? And, there's no easy answer for how to navigate that. I think that it is important to just know who you are, know who you know, like be humble when you need to be humble. And there is a little bit of playing the game. But what I did find, particularly in sort of navigating that point about how there are just some women who don't know how to create spaces for us all to succeed, is that I just became that woman. So like, I am a girl's girl, baby. Okay. And I root for everybody Black, always and everywhere. So that's just become something that's been really important to me, to, when that space doesn't exist, to very unapologetically at least use my seniority in spaces to create that, so that those who are coming after me don't have to navigate it in the same way.
Great, thank you. I just want to say thank you for sharing that. And it sounds like everyone's had like pretty difficult moments, and I'm sorry that has had to be a part of your story. But it also sounds like it really shaped who you guys are as like people and physicians. So I appreciate that you guys were able to share that. I didn't want to ask this question yet, but I feel like it really leads into everything that you guys are saying, and you might have like touched a little bit on it already. But I guess when you're in these spaces and these challenges are happening, difficult things are happening, how can you specifically advocate for yourself as a woman or as a woman of color, either or, whether that's during like negotiations when you're first about to start residency, or whether that's like your schedule or your actual like role and responsibilities within your specialty?
I can speak to this because I'm still learning this even as a faculty member. So there are so many ways. I think on a medical school level, receipts always. Okay. So everything, every level, receipts. You need emails. If you have a conversation in person with someone, you follow up with an email saying, hey, just wanting to put out there what we discussed, make sure that we agree on what we discussed. Everything needs to be written down. And if you have an institutional email, forward it to your personal email, because there are situations in which you get kicked out of an institution and your email gets access is shut off that same day. Okay, so God forbid that happens to you, but it's happened to some of my colleagues. So every single thing is written down. You have the dates, you have the receipts, you have the names. No one can try to play, you on what happened. I think that's the most important thing. There should never be a gray area on what happened. That's number one. Number two is be proactive in asking for feedback as you go through things, because unfortunately, faculty are not always the best at giving you feedback. So if they have a problem with you, they may not tell anyone until it's a letter of recommendation, or until it's a eval, or until they're talking to a faculty, someone else. They won't be honest with you, but they'll be honest with everybody else, right? So some of the techniques that I've learned that can help protect you later is asking very specifically at the beginning of a rotation what is expected of you. Midway, asking if you are, excelling in this space. If they say, yeah, you're doing great, then push a little bit and say, can you please give me more information on like what I'm doing well and what I should improve on? If I want to, they might, oh, just read more. Okay, thank you so much. Like, what would help me to get from where I am to operating at the level of a resident? Certain questions that can kind of help them to push them to say certain things, because unfortunately you can get blindsided by some of the things that people think about you if you don't kind of pull some of that feedback out of them. When you get negative feedback, two things need to happen. Again, one, document, but number two is self-reflect, because there are situations that I'm seeing this more and more as well, whereas women of color or the medical students of color are also coming into spaces assuming that some of the negativity is based on their race and based on their gender. And so two things can be true. We do tend to get treated more poorly in these spaces, and also you also might not be behaving as you need to behave. Both can be potentially true, right? So if you self-reflect and see that there's feedback that you need to fix it, right? Don't let someone give you the same feedback twice, okay? Because if someone has to give you a great example is if someone tells you, I need you to be on time if you were late, right? Don't be late again, right? Because that will get brought up in another space outside of you as unprofessional or things like that, right? Now, on the faculty level, when it comes to trying to negotiate for yourself, right? Trying to speak to other people, speak to other women, understand what they're getting paid, understand what they are, what's on their contracts. You have to be careful with who you speak to, but try to find someone in the space that you're trying to enter that will be honest with you about what's going on. You will be shocked to see how even in academics, where they will tell you straight up that contracts are, they'll use these words to say that the contract is what it is and it can't be changed. But then you'll see that your colleagues have different contracts than you. Okay. So I've experienced this myself. So when you speak to people, you have a better chance of being able to advocate for yourself. And I had some attendings. And again, the attending that helped me to negotiate my contract the best was a white woman. But she said straight up, this is not, no. Ask for this in perpetuity. Ask for this guaranteed for 2 years. Ask for this, not the non-compete should not be that wide. Ask for this and that. Everything was changed on my contract after I said it. So if I didn't say anything, that means that I would have got played on my contract because I didn't have the information, right? So when people have tried to come to my job, and I should be careful because I'm at my job. Hopefully people have left. I'm the last one here. Anyway, when people try to come to my job, especially people of color, and they're thinking of coming to Baylor, here's the contract, baby. This is what it is. So they offered you something different. Well, this is the contract that I have. I have no problem saying that, because those are the kinds of conversations that help to protect me when I was coming into this space. And those are the things that I know will continue to protect me when I'm going into other spaces. So those are some things that I've learned. Also pay attention to certain words. Okay. Belligerent is a key word. If you hear the word belligerent used with you as a Black woman, that is someone maybe trying to set you up and set a precedent, right? Those are the kinds of things you pay attention to, certain words that are being used, and make sure that you are protecting yourself by documenting what actually happened in those spaces. Difficult, not a team player, certain things that will be tried to phrases that try to put you in a certain light, right? It's so funny because I remember the first time belligerent was a word that was used with me in an eval. And I said, the thing about it is, if you know me, I'm not, I am a teddy bear. I am so chill. I like to joke around. I'm a clown. So when someone, and I'll say this and I'll stop talking, but the situation was someone asked me to apply for a grant, a diversity grant in a space that I was in that was very not diverse. I was the only person. I was the diversity in the space, but they wanted me to apply for this grant to get funding for this department, claiming that the department is diverse. So I just didn't say anything. We were in a meeting. I just was quiet. My face may have said something, but I was quiet. So then the person asked me, hey, do you have thoughts on that? Like, what are your thoughts on applying? And, and I'm like, oh, let me just listen to your spiel and then we can talk. No, give me your thoughts. Give me your thoughts. I said, okay, well, I personally don't feel comfortable applying for this grant based on what it's supposed to be awarding. The space that I'm in, I don't feel like I would be able to put together an honest application based on that. And then 2 days later, I was told that I was belligerent. I said it to them how I said it to you, right? So again, if belligerent means disagreeing with you and being honest about my opinion, well, then 100% it's because I'm a Black woman in this space, because that's not belligerent, right? We have to have an ability, even in academic spaces or in workspaces, to speak our minds and to be honest and open in our spaces. So yeah, the advice that was given to me was to document and to make sure. And there were times in which the documentation that I had from that experience became important in the future. So those are my main tips for protecting yourself.
I think to add on to that, and I agree 100% with all those things, the paper trail, baby, like number one, receipts, definitely a paper trail. I think the extra piece on the paper trail is that if you have an advocate or someone who is in your corner, actually like who already knows if you're already having an issue and now there's ongoing things, be CCing them on that email so that there is someone in real time who is part of that paper trail, because it doesn't become a he said, she said, because they're seeing the conversation in real time. And, every now and again, it actually is important, let's say that there is like true hostility and you have a supervisor and like you're getting hostility from someone else. Now it's no longer a BCC, like it's an actual copy of your supervisor. Like before I went to medical school, I worked for this nonprofit and I was getting an eval from my supervisor, and twice she called me aggressive. So after the second time, I told her that she will either need to choose a new adjective or we will have to continue this conversation with HR. Because after the first time when I asked her what she meant by aggressive and she couldn't tell me and then use it again, I was like, yeah, so here's what we're no longer going to do. We can work on finding new words or we can continue this conversation with HR, because no. So sometimes it is a matter of like calling it out in real time and shutting it down. And sometimes it's a matter of just having someone who's in your corner who knows what's going on so that when you have to pull it out, you have them there. There's a question in the chat about whether or not residency contracts are the same way. Unfortunately, no. Residency contracts, they are pretty cut and dry. Now, there's nuances to that if you're at a residency program that is unionized, but that negotiation does not come in a one-on-one place. The negotiation is at the high level with the union and the institution. So there are not like specific things that you can negotiate for in your contract per se, but there's certainly things that you can use to protect yourself, rotation through rotation, some of that being like very specifically asking for feedback, trying to have closed loop conversations, and not just asking for feedback at the end, but even at the beginning of a rotation, having some goals, like here are the things that I really want to work on, or here are the things that I've received feedback from before. I worked with you last time, you mentioned A, B, and C. I've really been trying to figure out how to work on that. I'd appreciate if you could give me some feedback on sort of how I'm doing on that process so that you can demonstrate to them that you're hearing what they're saying and that you're also putting that into work. And I think those are the big pieces. Residency can be hard because, yeah, a lot of the things are just put on you, but you need to ask questions. Sometimes you do need to just like verbalize in real time. And this could be, for example, I had an issue with a nurse in the PICU when I was in residency, and she was so rude to me over the phone. And the last piece of her conversation, she called me for advice. I told her what to do. She asked me again. I explained to her why I wanted her to do what to do. And then her response was, do you want to wake up your fellow and ask them? No, ma'am, I want to tell you what I'm going to do. And I woke the fellow up just to make sure that I'm not crazy. The fellow was like, yes, that's an appropriate plan. I went to bedside and had a conversation with the nurse. And sometimes you just have to de-escalate things in real time. Like it seems like our conversation over the phone, or it seems like our conversation over email, there was some miscommunication. Like, can we get on a call or can we get on a Zoom or something and talk it out? And that's also important, because written conversations or phone conversations where you're not able to pick up on body language can certainly be misinterpreted. And so the other added advice is to choose, like sometimes push and create a venue that is more able to like clarify conversations that might be in person or over Zoom.
Okay, thank you. Or do you want to chime in at all, Dr. Ade?
No, I think both covered everything that I would have said. So
Great, thank you. Um, so I think I'm going to shift gears a little bit because I know we have like a little bit less than 15 minutes left. So I'm going to try to I had so many questions planned, but I'm going to try to squeeze in a couple more. Um, so just kind of shifting to just like personal life and kind of just like things outside of the hospital, basically. Um, how would you say you balance career demands with personal life, family planning, relationship? Like, how are you balancing burnout or just doing, like, maintaining a sense of identity outside of medicine?
Yeah, Ade, I feel like you should answer this because, girl, you be on trips.
I was just about to say, I was about to say, based on
we
social
know
media, I
you
feel like
like
you should answer.
you be
Yeah.
on trips, catching flights out of country. Please share the day.
yeah, that's a great question. I'm happy to answer it. I don't have the perfect response, but I will say social media is one thing, right? So if you look at my social media, oh yeah, she's always traveling XYZ. Yeah, because I'm not posting my day to day when I'm in the hospital. And I intentionally don't post like when I'm working just because I don't want anyone to say anything. So I don't like, you won't even really see me in like the day of at work. So I would say be careful what you see in social media because it's not super accurate, is one thing. But I will say I have been blessed to be able to travel a lot in residency. That was not something that I anticipated being an opportunity, but it's just something that has happened. So my program, I'm emergency medicine. We get a lot of elective time in addition to vacation time. So that's how I've been able to travel while also doing things in terms of media, all of that virtually. So that's kind of how I balance both. So I just got back from Nigeria. I'm traveling again on Sunday. So that's kind of how it's worked out for me. But I understand that a lot of specialties don't allow that at all. I will say it's been a positive experience being able to travel, but it has also created a lot of exhaustion for me and burnout as well because I don't necessarily only travel for leisure. Sometimes I travel for talks or conferences or things like that. So that can be pretty tough, like with my schedule, switching from days to nights to evenings, and then trying to hop on a flight and then coming back and then maybe working an overnight. I'm not complaining. It's just kind of like how it has worked out. So there are some sacrifices that you have to make in terms of trying to make that happen, but it also really depends on your specialty. And I will say that this is a good time to talk about when you are considering your specialty, it's really important to think about the life that you want to live. So, again, there are a lot of rigorous specialties that people make it work. However, for me, I knew I wanted flexibility and I knew that pursuing a career in OBGYN just wouldn't have allowed me to do that yeah, at least for me personally. But I do know some OBs out there who are able to do both. But just for me, I just knew I didn't love surgery and I knew I would have to pursue a fellowship to get the flexibility that I wanted. And then that would have been a 7-year situation. So it just wasn't for me personally. So it's very important to think about the type of lifestyle that you want to live and if the specialty aligns with that when you're in medical school. I would say personal life, I'm single, definitely have tried to date in residency. Yeah, it's a challenge out here trying to do both. So, hopefully it will be better as an attending when there is more time. And I do hope to get married and have kids. I'm not there yet. So yeah, that's kind of that reality too. So yeah, I will say, when you are trying to balance things, at least in residency specifically, in medical school too, it's possible, but you might have to sacrifice sleep and sometimes your well-being. So it can be a catch-22. So it's not always as glamorous as it looks like on social media, I will say.
Yeah, I would agree with that. I actually don't necessarily think that there is balance because it's more like a pendulum swing. Like sometimes you're able to really lean into the wellness, and other times you are grinding. You're on day 12 of 14, you're on that stretch, and all you can do is eat, sleep, and work. And that's okay, particularly if it's just for a certain season. But the most important pieces, one, are about giving yourself grace and surrounding yourself with people who will also give you grace. So trying to make plans, and if like even if your body doesn't feel up to it, knowing that the people that you're spending your time with are like understand if you need to cancel. Having days where your goal for the day is to couch rock for as many hours as possible, like that is wellness, and no one can tell me otherwise. So, and not feeling like, oh my gosh, I've been on the couch, like I'm on my fourth episode of All Her Fault, which yes, I binged in 2 days. If you haven't watched it, you need to. And I have like all this stuff to do. It's actually okay sometimes to just not do those things if you have the flexibility of it, because it is giving yourself the chance to decompress so that you can come back and be great. For me in residency, like being able to make sure I had time away from the hospital was really important. And so I am like a manic schedule checker. Like I know my schedule, if I have a weekend free, sort of like what the nuances of a particular rotation are. And so I'm planning vacations 6 months in advance. If we did our vacations in 2-week blocks. And so I would always make sure I had at least 5 days where it was like device free, like no work, no meetings, no nothing. Can't do all 14 days because sometimes you're using vacation to catch up on stuff, but like at least 5 days where it's literally just reset, refresh. And that was really important. For like myself and some of my Black co-residents, I would stalk everyone's schedules and I would see when we were all free, and I would just like make a reservation for brunch. It's 2 weeks out. And I'd be like, hey guys, I noticed that none of us are working on this day. I've got reservations for brunch for the 6 of us. Let me know if you want to go. And so that was helpful as well. So just trying to be a little bit more intentional, thinking ahead helps, particularly in residency when there just is no time. And then just to kind of bring up what Ade said about like choosing your specialty for the lifestyle you want. Now, sometimes you can do that and not avoid fellowship, but other times, like myself, like you do fellowship in order to make sure you can get that flexibility, because emergency medicine does, like with the shift work, it really does give you the opportunity to still provide the same quality of care without needing to be in the hospital or seeing patients every day to build on what you're doing day in and day out. And so as a general pediatrician, I just was not going to be able to get that. There's also a lot of things in general pediatrics that like hard pass and I don't want to do. So that is why I'm here as a PGY7, still in fellowship. But when I finish, it'll be great and I'll get the flexibility that I want.
Okay, I'll say this for like 2 seconds really quick because I know we're almost out of time, but 2 things that were told to me. Well, one thing really is that as a woman, you can have it all, just not all at once. And I think that's really true, right? So for me, I'm a poet. I'm a spoken word poet. And during college and definitely after college, I was performing regularly. I was headlining shows. I mean, I remember my first booked out show in DC, how I felt like a rock star. And then residency, and it's like, am I even a poet anymore? Do I even still perform? Like, if people who know me from back in the day, that used to be my social media, was posting poetry. Now I don't even feel like I have the creativity to write all the time. But I know, and I'm planning strategically, some of the things that I'm working hard doing, even including social media, are to give myself financial freedom and space to be able to do medicine the way I want to do it, such that I will have the freedom to dedicate more of myself to that as well. So although it can feel depressing to not have an outlet all the time, I don't think of it as balance is not always going to be achievable if you want to be great at any one thing. So if you're going to be great in medicine, you will probably be out of balance in your personal life at some point. If you're going to be a great poet, you're probably going to be out of balance in medicine at some point. If you're going to be a great mother, you're definitely going to be out of balance in your career at some point. If you're going to be a great career person, you're probably not going to be in balance in your home at some point. But that's okay, as long as you're making sure that you specifically dedicate certain times to all of those things, so that over the arc of your life, you have everything, even if in each moment you don't have everything. And so I think that's powerful advice that has allowed me to calm down when I feel like I'm just not getting all that I want in life. And then the other thing that I did do all through medical school and residency, and I grew up keeping the Sabbath, meaning that I don't work from Friday night to Saturday night. And because I grew up doing that, I never studied for a 24-hour period every single week, all through high school, college, medical school, residency, even till now. And that's been invaluable because it was a habit for me growing up. It's a guilt-free no work. So even if you didn't grow up doing it, I do think you should cultivate a space of guilt-free no work, because it helps you to sharpen your axe, so to speak, even though you're not working for the full 7 days. That seventh day that you're not working allows you to sharpen your axe, talk to your family, recharge, so that you're going harder than everybody else those other 6 days. So that's something else that was helpful for me.
Thank you. Thank you for sharing and also answering questions in the chat as well. I'm just going to end on this last question and try. I'm really sorry for those who are asking questions and we couldn't get to your questions, but I'm going to try to like all bring it all together with this last question. So I just want to know if any of you guys have like last minute words of advice and just words of encouragement to tell everybody who's online. I saw that some people wanted to hear a little bit about imposter syndrome. Others wanted to hear about like maintaining relationships and just mentorship as a whole. So if you have any general advice or want to touch on any of those to kind of let everyone go away with, that would be really helpful.
I mean, I'll just keep it short and simple and say that the most invaluable advice is that the three of us here today are walking, living testaments that there is space for you and you exist reflected in this profession. And so we're all available to chat to help you through that way. And each of us has a network of dozens of women who poured into us. And so we're always ready to keep that web going. So reach out.
I think my big piece of advice that I always give to my mentees is, as a woman, and especially as a woman of color, lead with your competence, not with your warmth. So what that means to me is a lot of us have been taught to be warm, to be sweet, to smile, to be kind. And I'm not saying you shouldn't do those things, because if you can be competent and warm in equal amounts, that's the best. But if you don't have the bandwidth for both for some reason, don't slack off on your knowledge and know people's names and smile and all that. No, you really want to make sure that you're leading with your competence. So, and I want to be super clear. I'm definitely not saying to not be a good person on rotations. You always need to be kind to everyone. But it is not acceptable, especially in this current climate, for you to be the only person on that rotation that doesn't know the medical knowledge, doesn't know what's going on with your patient, doesn't know, isn't reading, isn't on PubMed, doesn't know an article that's come out recently in the last 6 months about, something going on a patient you're taking care of, but you're the person that is, buying a faculty a cup with their name on it. I mean, I have multiple students that rotate with me, and at the end of the rotation, maybe, that maybe they didn't listen to the advice I gave them or even the feedback that I gave them, but they are buying me a candle to say thank you for I don't need a candle, I can buy my own candle, right? As a Black woman, if you're rotating with me, I want you to be excellent so I can talk about you behind your back in other places and put you on, right? The candle doesn't help me do that, right? So always remember that you need to be competent. You can be competent. You are competent, but demonstrate that. Speak up. Ask questions. Don't say, I think it's this. Say, I favor this, but my differential includes this, right? Say things in a way that demonstrates competence and that demonstrates confidence, because if you can even pretend to have the confidence of a mediocre white man, I promise you, you will look that much more intelligent in these spaces, okay? So it's very important. Add your warmth to it as well, but be competent, okay? Y'all got this.
My piece of advice would be it's okay if your journey does not look super traditional. So although I went through 4 years, etc., I do a lot of media creativity work. And that's what fuels me, especially like at the end of year, whatever, 12th year of school, like I'm very tired, very depleted. But doing that work really fuels me. Writing an article, although I don't really have the energy to even write right now, as Dr. Sempa said, I just, hopefully in a couple months I'll get there. But really just going back to that why, for me, it's really standing up for minoritized populations. Like that's what really reminds me, like when I'm in an hour-long code, my back hurts, all of that. Like it's really important that we're in these spaces. So as cliche as it says, remember your why. I do think it's very important. And then also like there's increasingly more space for non-traditional paths in medicine. So if that's you, don't be afraid to pursue that.
Okay, great. This was an amazing talk. I'm supposed to be tuned in, so I had to be, but I really enjoyed this. And I just want to say thank you so much again for being here and being honest and being genuine. Like so many things, at least personally, that I needed to hear. And I'm sure everyone who's listening, hopefully they feel the same way. And I also want to say thank you for everyone who's listening and who's been like engaged, asking questions. I really appreciate it. And I hope everybody has a good night.